12 warning signs of liver damage. Liver damage affects hundreds of millions of people worldwide and is a leading cause of death and disability, partly due to its silent nature, showing very subtle symptoms, which makes it hard to detect. In this video, we'll be going over 12 warning signs of liver damage. Number 1. Unexplained fatigue. Fatigue is one of the most common and early signs of liver damage. The liver is responsible for many functions that support the body's energy levels, including the processing of nutrients and the elimination of toxins. When the liver is compromised, it becomes less efficient at these tasks, leading to a buildup of waste products in the bloodstream. As a result, you may feel tired all the time, no matter how much sleep you get. The fatigue may be mild at first, but can progress to the point where everyday activities feel exhausting. This type of fatigue is different from ordinary tiredness. It's often persistent and unrelenting. If you notice that you're struggling to stay awake or energized, even after a full night's rest, it's crucial to have your liver function checked. Number 2. Bruising easily. The liver produces proteins that are crucial for blood clotting, and when liver function is compromised, these proteins are not produced in adequate amounts. As a result, you may bruise more easily than usual or experience excessive bleeding from minor cuts or injuries. Even bumping into something lightly can cause large bruises to appear. In more severe cases, you might experience spontaneous nosebleeds or bleeding gums. Easy bruising is a clear sign that your blood isn't clotting as effectively, which can be linked to liver dysfunction. If bruising occurs without obvious injury, or if you experience increased bleeding, it's important to consult a doctor to determine if your liver is the cause. Number 3. Abdominal pain and swelling. Pain in the upper right side of the abdomen is a common symptom of liver damage. This pain is typically dull and aching but can intensify if the liver becomes enlarged or inflamed. As the liver swells, it can press against surrounding organs, leading to discomfort or a feeling of fullness. If the liver is seriously damaged, fluid may begin to accumulate in the abdomen, a condition which occurs when the liver's ability to regulate fluid balance is impaired, leading to a swollen, bloated abdomen. The swelling may make the skin appear tight and shiny, and it can cause discomfort when bending or moving. If you experience ongoing abdominal pain or noticeable bloating, it's important to consult a healthcare provider to determine whether the liver is involved. Number 4. Jaundice. Jaundice is perhaps the most visible sign of liver damage. It occurs when the liver is unable to properly process and eliminate bilirubin, a waste product produced by the breakdown of red blood cells. The liver typically excretes bilirubin into the bile, which is then expelled from the body through the stool. However, when the liver is damaged, bilirubin builds up in the blood and is deposited in the skin and the whites of the eyes, giving them a yellowish appearance. This yellowing is often most noticeable in the eyes, and over time, the skin may also take on a yellow hue. Jaundice is usually a sign of more severe liver dysfunction, such as hepatitis, cirrhosis, or liver cancer, and should be addressed promptly to avoid worsening the damage. Number 5. Dark urine. Normally, urine is pale yellow, but if your liver isn't functioning properly, the urine may become dark. This is caused by a buildup of bilirubin in the bloodstream, which the kidneys then filter out and excrete through the urine. The dark color is a sign that the liver is struggling to process waste, and it can be one of the first signs of liver damage. Dark urine, especially when combined with symptoms like jaundice, fatigue, or abdominal pain, should not be ignored. If this symptom persists, a liver function test is essential to assess the degree of liver involvement. Number 6. Itchy skin. Itchy skin is a common symptom of liver disease that occurs when bile salts accumulate in the bloodstream. When the liver is damaged, its ability to process and excrete bile is impaired, causing bile to build up in the blood. This leads to a feeling of intense, widespread itching, particularly in the hands and feet, but it can affect the whole body. The itching tends to worsen at night and may not respond to typical treatments, such as lotions or antihistamines. If the itching is accompanied by other symptoms like jaundice or dark urine, it's a strong indicator that your liver may not be functioning properly and warrants professional evaluation. Number 7. Pale or clay-colored stools. The color of your stool can provide significant clues about liver health. Healthy stools are typically brown due to bile, which is produced by the liver to help digest fats. When the liver is damaged, bile production can be impaired, leading to pale or clay-colored stools. This occurs because bile, which is normally secreted into the intestines to aid in digestion, isn't being processed and excreted properly. Pale stools may indicate a blockage in the bile ducts or liver dysfunction. This is a serious sign that should prompt an immediate consultation with a healthcare provider, especially if accompanied by other symptoms such as dark urine or jaundice. Number 8. Nausea and vomiting. Nausea and vomiting are common symptoms of many health issues, but when they occur in combination with other liver-related signs, they may be a result of liver dysfunction. The liver plays an essential role in the digestive process, and when it's compromised, the digestive system can become unbalanced. The buildup of toxins in the blood due to liver damage can make you feel nauseous, and in some cases, this can progress to vomiting, particularly after eating or drinking. If nausea becomes a recurring issue, particularly when paired with fatigue, abdominal pain, or changes in stool or urine color, it's crucial to seek medical advice. Persistent vomiting can lead to dehydration and malnutrition, making it even more important to address the root cause. Number 9. Hepatic encephalopathy. Hepatic encephalopathy is a serious complication of liver failure, where toxins build up in the blood and begin to affect the brain. When the liver is unable to filter out harmful substances, they accumulate in the bloodstream and reach the brain, causing symptoms like confusion, memory loss, and disorientation. In more severe cases, hepatic encephalopathy can lead to personality changes, difficulty concentrating, and even coma. If you notice that you or a loved one is experiencing confusion, poor decision-making, or forgetfulness along with other signs of liver dysfunction, it's crucial to seek immediate medical help. Hepatic encephalopathy can be life-threatening, but early intervention can help manage the condition. Number 10. Loss of appetite. A loss of appetite is another symptom that may indicate liver damage. When the liver is not functioning properly, it becomes difficult for the body to process food and absorb nutrients. As a result, you may feel full or uncomfortable after eating very small amounts of food. Over time, this loss of appetite can lead to unintentional weight loss and malnutrition, as the body struggles to get the nutrients it needs. In some cases, nausea and abdominal discomfort also contribute to a reduced desire to eat. If you're experiencing a lack of appetite, especially in combination with other liver-related symptoms like fatigue, nausea, or jaundice, it's essential to seek medical attention to determine the underlying cause. Number 11. Swelling in the legs and ankles. Swelling in the legs and ankles is a common sign of liver damage, particularly in advanced liver disease. The liver plays an important role in maintaining fluid balance in the body, and when it is damaged, it can no longer produce enough albumin, a protein that helps keep fluid in the bloodstream. Without sufficient albumin, fluid leaks out of the blood vessels and accumulates in the tissues, causing swelling or edema in the lower extremities. This swelling may worsen throughout the day and can be accompanied by a feeling of heaviness or tightness in the legs. If you notice persistent swelling in your legs, ankles, or feet, particularly if it is accompanied by other liver symptoms, it's essential to seek medical attention to determine the cause. Number 12. Hemorrhoids. While hemorrhoids are typically associated with straining during bowel movements or pregnancy, they can also be an indicator of liver damage, especially if they occur frequently or worsen. The liver helps regulate blood flow throughout the body, and when it becomes damaged, blood pressure in the veins of the rectum can increase, leading to swollen veins or hemorrhoids. These swollen veins can cause discomfort, itching, and bleeding, particularly during bowel movements. If you notice that your hemorrhoids are unusually painful or persistent, and especially if you experience other symptoms like abdominal pain or swelling, it could indicate a more significant liver issue. If left untreated, the condition could lead to complications like portal hypertension, which requires urgent medical attention. Those were the 12 signs of liver damage. Did you know that the liver plays a crucial role in converting vitamin D into its active form, meaning that vitamin D deficiency can develop when the liver is damaged? Check out this video to learn about 10 signs of vitamin D deficiency. Thanks for watching. See you in the next video.